Hi dear doctors, welcome to class of Kid Recovery. Myself Dr. Parv and the topic of discussion is febrile seizures. Now febrile seizures means what? See, febrile word is itself suggestive of fever. Okay, febrile word is itself suggestive of fever. Febrile seizures are the seizures which are related to your fever. So seizures which are going to occur in children who are 3 months to 5 years of age. Now how to remember 3 months to 5 years? Please remember two words very similar. FEW is going to be few and FEVER is going to be fever. So few means 3 words, fever means 5 words. So 3 months to 5 years of age who are actually associated with fever, and fever also more than 38 degrees Celsius without the intracranial infections. There must be no intracranial infection that should be associated with it. Now coming on to JME. Now what do you mean by JME? Now see, understand, JME is something which is called as juvenile myoclonal epilepsy. Now I am talking about febrile seizures. So why I am telling you JME, juvenile myoclonal epilepsy? Because sometimes I have seen children doing this mistake that they will behave as if, the question will be asked on your febrile seizures, but they will answer the JME. So I just teach both these topics together in order to clear the confusion already. So JME is juvenile myoclonal epilepsy. So it is going to have a polyspike pattern. It's going to have what? It's going to have a polyspike pattern. So can you see 1 spike, 2 spike, 3 spike, 1 spike, 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 spike. So they are going to have polyspike, and of course spike, these are spikes and these are the waves. Spikes, waves, spikes, waves. So spike and wave pattern, and that's to polyspike and wave, the 4 to 5 hertz polyspike and wave pattern. So JME is just like, sometimes you must have seen while going to sleep, you just dream as if, you are falling from some place and you just like do this action. Okay, so it's just like a brief shock like muscular jerk, especially of the upper arms upon awakening. Generally it is seen in the morning time upon awakening. So sometimes they give the history like this also, like history of the child who is going to spill the food, okay, on the breakfast table. Okay, the child is going to spill the food on the breakfast table. So this history is again important. So what is the age group? It's 3 months to 5 years of age. What is the temperature? More than 38 degrees Celsius. What is the type of seizures? Yes, coming on to now, what is the type of seizures? See, febrile seizures are generally the tonic-clonic seizure. Okay, they are generally the tonic-clonic seizure, which is which is going to last for less than 15 minutes. So that's why these tonic-clonic seizures are actually the febrile seizures which is going to be there. Okay, one thing which I've seen people commonly doing the mistakes, they ask which type of seizures are common in case of newborns. So they feel that, if there's a newborn, the age group is like close to 3 months, so they just mark febrile seizures. No, common seizures in case of newborn is going to be subtle seizure. Okay, that's going to be which seizure? Subtle seizure is the common one. Now coming on to next important thing, what are the common causes? Please understand, the most important cause is going to be the viral infections. Okay, now please understand, there are several other causes of febrile seizure, but viral infection is something which is the most frequent trigger which you have to understand in the febrile seizure. Now what investigations will you do? For example, if you are suspecting like meningitis, it becomes investigation, it becomes an important investigation, lumbar puncture, so that you will be able to see that if there is meningitis and there is meningitis associated fever, so you have to treat the meningitis also. In febrile seizure, these are tonic-clonic seizure. I just hope that you know what are the different type of seizure. So just discussing tonic-clonic ones. So tonic means that there will be increase in the tone of the entire body. So there will be increase in tone of the entire body. Coming on to the treatment. So what will it have in the treatment? So if the seizure is more than 5 minutes, the very first thing is going to be IV benzodiazepine and IV lorazepam. IV diazepam is something which is given to abort the seizure, and in children also we give the benzodiazepines only. And of course, in order to take care of the fever, we give the antipyretic acetaminophen to reduce the fever. And we have to understand, like, we are supposed to find out what is the source of infection, and we have to treat that source of infection also. Like, it can be because of what? Because of the sore throat, it can happen. It can happen because of the kidney issues, kidney failures, kidney damage. So all these things can occur. Recurrence is the most important, the most common, the most problematic complication which occur of febrile seizure. So that's why we have to understand that we have to abort this recurrence. We have to be prepared for this recurrence, and you have to counsel the mother, counsel the parents that whenever the child throws seizures like this or the child is getting fever, please reach out to us immediately, because child is at a higher risk of recurrence of febrile seizures. Although the prognosis is excellent, there is no long-term epilepsy risk or long-term neurological issues which can happen. Coming on to the important table, now what do you mean by your simple febrile seizure or complex febrile seizure? So please understand, those who are going to last less than 15 minutes is called as simple febrile seizure, whereas something which is going to last more than 15 minutes is called as complex febrile seizures. Now, simple one is going to occur only once in 24 hours, whereas complex febrile seizure, they can occur more than once within 24 hours. Okay. Simple febrile seizure is going to affect the entire body, and complex one is going to have a good complexity because it is going to be focal. It is going to involve only one part. Simple febriles, of course, the recovery is quick, whereas there will be a longer time which will be taken by a complex febrile seizure. So complex febrile seizure, please understand that more than 15 minutes, more than once in 24 hours, longer time of recovery, and one part only it is going to involve. Okay, so O for only one part. So there will be one part of the body that is going to get involved in the complex febrile seizure. So you have to be very, very careful while dealing with a case who is going to having fever and seizures all together. So thank you so much for watching this video. We will meet you in the next class.